All right, do we have a roll call, please?
Yes. Mr. Bell.
Here. Present.
Mr. Glenn.
Here.
Dr. Levy.
Present.
Second.
Present.
Absent.
Thank you.
So we have 4 out of 5, we have a quorum. So we'll have, if somebody wants to make a comment for the general agenda, I'll do a 3-minute comment period for the general agenda right now. But there's a place to sign up for specific agenda items, and you'll be able to comment on those agenda items right before the discussion and the vote. You look confused. Am I confused? You good? Okay. So if anybody has any, do we have anybody that signed up for a comment? Who's got that sheet? Austin, do you have that? Does anybody want to make a comment about the general agenda? No? Okay. Then we have the reading and approval of the minutes from March 27th and April the 3rd. And I would entertain a motion to forego the reading as they were sent out ahead of time in the package and approval.
I'll make a motion to approve the minutes from March 27th, 2025 and April 3rd, 2025.
And forego the reading.
And forego the reading.
Second.
Got a motion, got a second. Any discussion? Any opposition? Hearing none, that motion passes. And so we'll need another motion to approve the minute.
I move that we approve the minutes
As submitted, is that correct?
as submitted.
Second.
Got a motion, got a second. Discussion? No discussion. Opposition? None. That motion passes. And now we have the reports of standing committees and Mr. Shelton.
All right, thank you so much.
Anthony, really.
Good afternoon, board. Good afternoon, everyone that's here. So thank you all for attending. We'll draw your attention to our income statement for the.
Sorry, Shelton, let me interrupt you for a second because I need to add that agenda item early in the agenda. So we do have a request to add an agenda item, and that's because it was not submitted before the 24-hour period before the meeting, then it requires unanimous consent of the entire board. And the motion would be for an executive session, and it's here's what it reads: Henry Chauvin Architects versus West Ascension Parish Hospital Service District, 23rd JDC. Case number 139649, Division D, going into executive session to discuss legal counsel being able to negotiate settlement arrangement. So I would entertain a motion to add that agenda item.
So moved.
So moved.
Second.
Have a motion, we have a second. Any discussions, questions, any opposition? We'll have to do a roll call vote here. Austin? Yes.
Mr. Glenn.
Yes.
Dr. Levy.
Yes.
Yes. And Mr. Bell.
Okay. So that passed unanimously, and so we'll add that to the agenda. And it will be item 7, Roman numeral 7, at the end of the meeting. There'll also be an opportunity to comment on that before we take consideration of that and before we go into executive session. All right, I'm sorry, Shelton, I had to.
Just turning our attention to our income statement for the month of March. Net patient revenue is at 600,000. Look at other operating revenue that we had 207. Came out to be 807,000. Looking at our employee related expenses for the month, a little bit over budget. about 46,000. That's in dealing with our nursing training and education for there. Purchasing services are a little bit higher than what's budgeted. That's driving for pharmaceutical sales, bringing in sales from out of the country, which is good on our bottom line, but we're going to see an increase right now. So net operating expenses is 711,000. We budgeted for 544. That gives us a net operating net income of 96,000 after we paid for everything. So that's driving this.
What was the budget on that? I can't see
We
it.
budgeted for 544,000. Our net operating expenses was right at 711. So that's putting us.
Oh, the net income, the
The
very.
net income that we budgeted for,
Yeah.
80,000. We made 96,000. Yes.
Okay. And so can't we see that where do we see that increase mostly?
So you're going to see most of that increasing in our net patient revenue. And that's driving because of our visits from the ER as well as our inpatient unit. And as we move into our ER stats, you're going to see that, yes, our numbers were a little bit stagnant. However, the acuity levels of our patients now that are coming in a little bit higher, so we'll be able to code a little bit more than what we were doing a year or even 2 years ago. So we are seeing now that patients are using our ER for the right reasons. So that's how that goes. Looking at your balance sheet right now, month to date for March 31st, cash and cash equivalents, 24 million. Net patient AR. This is really what Mr. Dawson wanted us to focus in on, because if you see from August 31st of 2024, our net patient AR was at 2.5 million. Right now it's hovering around 4.3 million. Current assets is at 29.4 million. Looking at fixed assets at 6.6. So your total assets now, Mr. Price, sits at $36.1 million versus August 31st of 2024, we was at 33.61 million. That's a $2.5 million increase for what we are doing right now.
And the August 31st, that's the end of the
That
fiscal.
was in the end of our fiscal year. Yes, sir. Yes, sir. And I know you like to see that comparison. Mr. Price likes to see what we started off with to where we're at right now. So that is an increase in what we're doing, which shows that we are in a financial, a good state at the moment.
So we're $2 million ahead of what we were at the beginning of the fiscal year.
Yes, sir. Yes, sir, we are.
Look, compliment you on that.
Looking right now at our capital budget, board approved us for 1.7 million. We did have our boiler that came in. So James Sealing, he stepped out. So our boiler came in for 90,000. My land finally came in at that 332,000. So that's putting us right now what we've spent total, 828,000. We have remaining $871,000 that's remaining from the capital. So we're still doing.
That's remaining in the budget.
Yes, sir.
Capital budget.
Yes, sir. Yes, sir.
Well, how do we stand on preparing that budget for the council?
So my team and I, we've started sending out emails to our department leaders. So each department leaders have received their operational budget assignments as well as their capital needs assessment. So what that means is I'm already start gathering their data now. So we're going to sit down with each department and go over line by line of what we spent this year, what we spent 2 years ago, and now what we're projecting to spend for this upcoming. Then that way I can be able to put together a significant budget, then be able to propose that budget to the board, and then once the board approves it, we can be able to bring it to the parish council. Yes, sir.
And we've been told that we go directly to the council, not through finance.
Yes, sir. Yes, sir. Yes, sir. We've been told that. The only thing that I would add, we have some aging equipment on our CT scan, as well as our portable X-ray units that I am looking to upgrade on that. Yes, sir. But that'll be on our capital budget items.
Excuse me, Sheldon, and on those boilers, matter of fact, the two out here, do we have to replace them or are they sufficient?
So your chillers, your chillers right now, they are sufficient. We did have that report, that they are in the life. However, we've been servicing them and they are working well, and we have been doing a lot with them. So they are working where we need to be. With the increase in our portable units that we have throughout the hospital. So it is working, and we are looking comfortable for the summer months.
Do we have an estimate of what it would, what does that would be, a replacement for the chillers?
So a replacement for the chillers is gonna be, somewhere north of, right at 3.4, almost $5 million. Yes, sir. But that's why we're continuing to do what we can with what we have now. They're working fine. So, but again, Wayne and James did buy 2 new compressors. So both chillers have new compressors on them. They do have new padded software. So everything is nearly brand new on them. It's just they're old. You think about it, they were brought here in the 70s. So, but they are still working.
Oh, good, then. That means then we don't have to be looking at replacing them right now.
Right.
It doesn't sound that old to me.
Yeah, especially with the new stuff on it, yeah.
All right, when we look at our sales and tax, for the month, that was deposited in March was 125,000. This was for our February, and looking for what was deposited on April the 7th was 166,000. That was for March. Total, right now we're hovering right at 1.3 million that we've received thus far for the sales tax.
That's so far this fiscal.
So far this fiscal year, yes, sir.
So I think when we prepare our budget, though, we need to be able to segregate out all this new industry that's here, and so we're gonna receive a bump in the sales tax on the original construction of these plants, and then it'll go down to just on what they're operating. So we're gonna have this big increase, then it's gonna go back down. So I don't want people to see this big increase and think that'll be forever. So we need to make sure we note that in the budget.
Okay, yes, sir. Yes, sir. This just goes over our current budget review. So as you see here, this just shows you where I'm at year to date. So total year to date here, 7.3 million in net patient revenue. You budgeted for 4.1 million. Operating was at 2.3. So revenue is at 9.3 million, which is good for where we are at this moment. So the total right now, we've contributed 1.3, almost 1.4 million year to date. So that's great for what we're doing. And it's all because of the work that the team has been doing. I like to highlight our nursing department as well as our respiratory department and our imaging department. They are driving these numbers. Also for our patients in the community that are trusting us with their healthcare needs. So that's driving there. As we look at budget review and planning for budget for next fiscal year, we're going to take into account the inpatient unit, and we're going to make sure that we are looking at all of those numbers. Also, I'm going to be making sure that I work hand in hand with Ms. Anastasia and James to make sure that the budget aligns with the needs of the district as well as what we're doing for our staff, because that's most important. Because, prior, we had staff, but we had to bring in new staff here to take care of our patients. So with that, Anastasia had to hire more people. So we didn't have that data last year. We do have that historical data now to move forward with a more in line budget of where we want to be at for this fiscal year. Any questions on your budget review for now? And that takes into account to what Mr. Price and I, we spoke with finance. Yes, sir.
We'll be okay right now.
And that's, Dr. Levy, you have any questions for me?
No, I'm just excited to see it grow. Thank you all so much for everything that you do.
That concludes my financial update. Mr. Dawson, did you take time?
Well, okay, item B, that's yours too.
Hey, look, that's me. I appreciate it. So our monthly standard reports We have Dr. Lewis in the house with us, so we thank her for all that she do, not only at the hospital, but throughout the community. Because anytime that we have any type of social services events, we pick up the phone, we call her, and she's taking care of what we need. The most important thing that we've been seeing, and Ms. Anastasia can speak to this as well, is our children. We have to protect our children. We've been seeing a lot of children coming into our ER with a lot of healthcare needs. So that's going to be a focus that Anastasia, as well as Dr. Lewis, will be having for these upcoming several months. But
Help me out, Shelton, like that child abuse reports and elder abuse reports. Is that people that came into the ER? Is that? Yeah.
Yes.
the total patients that Dr. Lewis saw was 20, admits she had was 2, consultation was 2, her observation was at 1, and she had 7 referrals. She was able to get into the community disability awareness resource fair with over 200 participants that we was able to help out with. So kudos to them.
Let me, before you go further, on that child abuse and elderly abuse, do we contact law enforcement on these situations?
Yeah, so basically the process is, the nurses or the, director of nursing will contact me, and so I go in and I do assessment along with the doctor, and, make a decision. Any marks of any kind, just remember that it's suspected abuse, so we're just mandated reporters. We have to make sure that we're covered at the library, at the hospital. We're responsible for any liability if you have an elder person that may come or that are receiving any type of maybe home health care services, for example, and if they come in with a mark, they can say they got it from the hospital. So if we see it on site, we have to document it, basically run a report. There's numbers that we get back, and also we get a serial number from the sheriff's office as well.
Right.
Moving on, MNC, we met on 4/15, and we approved and accepted the reports. Total patient visits at 433, had 4 admits, 4 consultations, 7 observations. The referrals was at 5. Everything else was flat with 0. Those were Medicaid admits and denials. The QA and our review, we had 1 chart for admissions that we reviewed, 7 observations, 1 discharge. Wound care, going back up in the right direction, 30 patients that were seen for the month. Imaging, 52 mammos, 30 ultrasounds, x-rays was at 84, and 22 exams from the outside to the community. So that's really good. Looking over our patient volumes for ER, my stats was at 441. Had a total of 100 x-rays that was conducted in the ER, 90 CT scans from the ER to CT. And then we had 7 observations. Transferred to another facility, I had 43. Had 8 AMA, and within 72 hours, we had 8. So that's an increase. That's where we want to be at.
Oh, can you back up? I'm sorry. The transfers to another facility, what's the main reason for that? We just don't have the rooms, or we don't have what?
It's not the room, it's on the acuity level of care. When we think about if I got a stroke that's coming through, I'm not going to take care of that. I'm going to treat, I'm going to stabilize, and we're going to send out. Anything like heart-related issue, anything like that that I can't treat here, I'm going to send out. But the good thing is the services that we can keep in the house, we're going to keep it here. But if it's something that's greater that is confident from the physicians and my nurses to say, Mr. Shelton, we cannot keep, we need to transfer out, we're going to do so. Yes, sir. Yes, sir. I like this number. You know, some people may say, okay, that's a high number. I like that number. I'll tell you why. It's because our community are trusting us enough to know that when they come here, that we're going to take care of them, we're going to stabilize them, we're going to give them the best care that they need. And they know that if they need to go to a higher level of care, we're going to send them to that higher level of care. So that's the good part that we have. So I am confident in this number. Confident in this number. Looking also, your nursing documentation, we're at 20 review charts, 98 overall for compliance. We're still back at that 80% on that pain, but we're gonna get there. Ms. Anastasia and her team has that as well. Flu A and B, 93 was ordered, Ms. Mitchell. 14 was shown to be positive. Also for scrap 8, we had 69 that was ordered with 3 positive. And on the RSV, we had 12 that was ordered with 1 that was positive. COVID, 19 ordered 99 and 4 was positive. So for the month of March, you can see that we do have some positivity. But it's at an area that we can maintain right now. If we start to see that number increasing, we would definitely direct the board as well as direct the community on next steps, what we can do.
At what point do you get concerned about the flu and the COVID? I mean, is it based on a percentage, I guess you have?
Yes, sir. So once we hit the,
And about 15% on the flu that came back.
once we hit our threshold for our area, which is 25%, we have to make sure that we're starting to do these things. But as long as we are within that, we're okay. I will tell everyone that although we're getting out of flu season and getting out of like COVID, look, it's still here. We are seeing a lot that's coming through the ER. Mr. Jean can tell you about that as well as Anastasia. So we have respiratory sickness coming through. I'm gonna tell you the last 2 weeks, we've had a number of pneumonia cases that we are seeing popping back up again. So it's also good that we do have our inpatient unit. Why? Because we can give them antibiotics, we can give them a lot of fluids here in the hospital, keep them here, keep them local, and then send them back home. That's the way we want to do it. Put on your respiratory therapy notes, 11 ABGs that was conducted, 936 oxygen hours that we used, bypass was at 3. We did 72 EKGs for the month of March. Plan of care for environmental care. All of your radio testing has been completed. We do have Mr. Jared working with Mr. James to making sure that everything is documented properly. The generator testing was completed, as well as our safety risk management plan, the line utilization, isolation test, medical gas testing, our fire extinguishers are all completed. Your cutoff and oxygen valves, your ground fault testing was all completed for the month of March, and that was presented up through environmental care. The egress lighting, as well as our hazmat and waste management plans were conducted. So all of that looks good. No activities for occurrences. You pause right there. You see there? Occurrence incidents from your physicians, your outpatient and visitors, all at 0. And remember, I've been stressing out, we want to get to a point where we are at 0 harm for our hospital, 0 harm for the community. So that's good that we're at right now. 0 products for a product recall that was noted for the month of March. I have started working with our IT team as well as Mr. Quincy to put down 3 new additional cameras. These newer cameras that we are looking to have are going to be here on this complex, so that we can have a little more visibility on this complex, especially as we're starting to move and partner with our PCC to make sure that we have some students here in the afternoon times. More to that's going to be coming. That's going to be shared out with the board for public knowledge. Your fire drills and your emergency drills are being completed monthly. All of our annual training is ongoing. And I'll stop right there because you see that, Mr. Dawson, that said patient complaints.
That's where we expect it to be.
That's at 0. Now, sometimes we don't like to see a big 0, but in this here, I give applause to our staff for what they're doing. When we say eyes on everything, and we mean eyes on everything, we mean we checking patients in from the time they register to the time that they're seen in the back, to the time that they receive their meal, to the time housekeeping comes to their room, to the time that our maintenance team got to come and change the light fixtures. We're making sure that we're taking care of our patients, and that's
good.
0 complaints. We had our IT cyber report. Implementation of our hospital television system has been completed. The Microsoft Secure Score report is working. We have 96 active users, 23.5 activities, 23.5 thousand activities, excuse me, that's been noted. So we are doing well on our cyber. In the past,
Can you back up at that? What is that television deal?
Hospitality television system. So for our inpatient unit, that was one of the main things that we wanted to make sure that all of our patients that come into the ER, We have now 4 rooms in the ER, Ms. Anastasia,
Yes.
that have televisions in those rooms. You go to most ER, you don't have the television. So you sit there, you're mad because guess what? You're in the hospital, you're sick. But the times for us, we found in rounding with our patients, we found for patient satisfaction, what can we do to make sure that the patients are a little more comfortable while they're in the ER? So now when you come to the ER after my doctor assessment, after our nurses assessment, then we make sure we turn the TV on. So you can relax and be comfortable. So we have the televisions there, and we also have the television on your inpatient unit. So now on your inpatient unit, as time you are admitted, you get a QR code. That QR code is signed for you and that room, and your channels on your television is there. So our team worked tirelessly to make sure that they put all of this together for patient comfort and patient satisfaction. So kudos to the team, and also kudos to the board, because you all allowed us to be able to make sure that we put our patients first in everything that we do. So that's great there. In the past 30 days, we had 691 exchange messages, which were quarantined or recognized as phishing scams, okay? And this is up, but it's noted that we are catching it. So we're not making sure that anything that's malicious is coming into our hospital. And our IT team is catching all of those exchange messages. Email activity is up 7.5% in the last 30 days. You might tell me, why are the emails up? Okay, emails up because I send out emails to the staff, and I make sure the staff know what we are doing. Also, the email usage is up from Anastasia as well as from James to make sure that the staff is being aware of what's going on at all times. So that's good. New anti-phishing email campaign is being developed for random distribution starting May 15th. This is going to be pushed out to staff. This is also our teach back moment. So as we are working with the staff and telling our staff, look, when you have emails that are coming in that you don't know who they're from, do not open them. We're going to be sending out a campaign to our staff, making sure we're going to send out some tests, and we're going to see the compliance. And then that way, I can be able to report back to you. I believe in teach back. I believe in making sure that we're going to push out something to the staff, that we're holding the staff accountable, and we're educating. And if we have some blips, we're going to work on that, and each department leader will be working with their staff. So this will be good that the IT team is working on that. Our quarterly user license and auditing documents will also be distributed on May 16th of this year. Leadership team, administrative updates, continuing general education for our staff with Elias. I am about to roll out Hardwire Excellence. Hardwire Excellence is going to be given to all of our staff to show just our commitment to continuing education, process improvement, and making sure that we are becoming a journey to excellence ready organization. And that's where we want to be. And that's why our key mission is zero harm. Continue to focus on our MCN policy platform. MCN is where now all of our policies that we have are going to go into this platform database. In this database, we're going to be able to have all of our policies for any policies that need to be reviewed or updated or just even educated to the staff. We'll be able to have it there, and the staff will be able to utilize that. And that, Mr. Dawson, concludes my report. And now we'll turn it over to the board.
Thank you. On the chairman's report, the only thing I have to report is I talked to Dr. Trevino of the Lady of the Lake today, and asked him what's the status. They're supposed to be in the process of putting together a proposal to us, and he checked on it and he said that they are working on it, and that he's going to try to push the completion date. So that's still in the workings, and I don't know whether any other board commissioners have anything? No. Okay.
So moving on to our new business, and we're going to be meeting for the quarterly reports. This afternoon, we're talking about our wound care. So just looking at the trends right now in wound care, hovering around 3 new admits for January, February, and 2 for the month of March. So that's going in the right direction. That's what we want. New patients coming into our wound care. We are proud to say that In February, I had 2, and in the month of March was 2, both from the ER. So that's a positive, that we were getting patients from the ER utilizing our services here. So I wanted just to show that. The laboratory, this is their performance improvement and trending calendar for the number of reference lab discrepancies. You see for the month of January, we had 1, February and March, both is at 0. So we're hovering around 100% for troponin, turnaround time less than an hour. There was only 1 discrepancy reported for the year, for the quarter, which is good. ER patients without armbands, laboratory staff received 2 for the quarter, but both of those incidents have been identified. Chase with the lab has worked with the staff, as well as Ms. Anastasia and her nursing team has worked together to make sure that when our lab comes to draw your lab stuff, patient identification band is on. So that's going well. Patient satisfaction surveys, you had 2 that was positive, so everything else is looking good on the laboratory department. The ER, trending on your patients, you can see in January, you had 406 patients. Remember, we had that dip in February to 379, but look, we back up to 441 for your patients today. That's good. The discharge from the ER within 72 hours, you can see that we're back to trending back up, so that is where we need to be at, and that's around 370 patients that we discharged from. The monthly transfers year to date, January we had 28, February was 16, and 25 to acute hospitals. You look at for behavior health situations, 6 in January, 4 in February, but 14 in March.
That's the key.
Yes. And Dr. Lewis?
Yeah, so we have a high level of PCs ranging from primary to high school. And so we have already talked about kind of formulating some groups, some support groups. It just depends on age appropriate things, but we're already talking about that, me and Mr. Shelton, to support that because we have so many high needs that are here. We're having to shift them out.
You include me in.
Of course, of course. The goal, Ms. Mitchell, is that we're going to put together our own West Ascension Parish Hospital task force on this very specific situation that we have, because it's affecting our community. We want to be able to have our community leaders involved, but also have the school and have some of the parents, because it's a team effort right now. Hospice, we just had 1. Jail, you had 3, and nursing home, we had 0. So this, Ms. Dawson, shows you a little bit better on where we're sending those patients. So yes, we have the 25 to a higher level, but that 14 is really driving that number. That's really driving it. Social services quarterly reports, that's from Dr. Lewis, and this shows her trend of what she's doing, the number of patients that she's seeing in her consultations. So that's great there. Your respiratory numbers, your ABGs showing your 9, your 7, and your 11. It shows your oxygen hours. This is significant from 280, 288, 600 to 936. James, you want to speak a little bit about that?
Oxygen hours are increasing because we're coming off the high peak of respiratory illness season. So you do have more patients utilizing oxygen. It also utilizes more when you use the ventilators or live. So this is your PPE season coming down a little bit. So that's why you see a little increase in oxygen hours. It's going to level off during the summertime. It'll level off.
Now I do want to introduce, this will be the first that I get a chance to introduce our respiratory director to the board, Mr. Gene Pope. Mr. Gene, stand up for a second. Mr. Gene has been a respiratory therapist for how long, Gene? He's been around, but we're glad. Gene used to work here back in the day. I'm not going to say when he was back in the day. But Mr. Jean came back, and we're thankful for Mr. Jean. This was a role that we needed to fill. We have Brother James, but Brother James had a lot, and he's getting more and more on his plate. But respiratory still reports underneath James' division. But James has a lot that he's doing. So bring it on, Jean. Jean has a lot of ideas. You want to talk about your ideas that you got?
Yes.
You can go to the podium, Mr. Dean. Good.
For a second.
My name is Gene Pope, and I'm the Director of Respiratory Care, and as Mr. Shelton says, I've been doing this. And, our vision is not only are we going to give good respiratory care, but we're implementing some new, we got some new techniques that we do. We're also, we purchased a machine, a device that we can detect, the carbon monoxide, pulse ox probe, and that was real important during the wintertime because of you have people using these space heaters, and I also had got a chance to visit some of the doctors' offices in the community and introduce myself as well as some of our ideas and some of our some of the services that we also offer. So,
Thank you, Jean.
Welcome.
Yeah.
I love to see people that are a little bit senior to get back in the workforce.
Coming back. Good. And then that's all that I have on the quarterly reports for this month.
Did you mention, I might have missed it, did you mention how many inpatient beds did we use this past period?
So I will have that. I will get into it. That's all on the quarterly report. Okay?
Master plan.
All right. So for our master plan for West Ascension Parish Hospital, the board was able to meet in a special session on April the 3rd. And basically, at April the 3rd, we was able to partner with Grace Avery and Curtis. And the purpose of this study is going to be evaluate the current facility conditions and future validity and viability of what we have. Access potential for new hospital construction on our adjacent property, support long-term strategic planning. So their scope of work currently is to look at our hospital assessment, identify reusable space for outpatient care, review available drawings and photo document conditions, new facility due diligence, feasibility of the new hospital on our open land, to study our outpatient expansion potential, including estimated square footage and cost opinions, facilitate use option on renovation versus new construction, cost analysis for each scenario, space programming, and patient volume projection, and then look at our strategic impact, improves quality of care and operational efficiency, positions West Ascension Parish Hospital for further growth and modernization. It's going to also enhance outpatient service capabilities for the region, strengthens our community health infrastructure. So that's the reason why we went with Grace Avery and Curtis right now. Just look at a study. This is the first step of what the future for West Ascension Parish Hospital can look like. So
And we had a not to exceed in that.
not to exceed $35,000. Yes, sir.
Now, do we need do we need a motion on this?
No, sir, we do not need a motion on this.
Okay.
Okay, any questions on your master plan, please? If not, we do have one board resolution.
Yeah.
Mr. Dawson?
You know, I had written this, and then, I don't know, it might have been Shelton. He added 2 or 3 pages to it, so. Now I can't find it, yeah. I'll take a break for a minute. Okay, So we have a board resolution, West Ascension Parish Hospital Service District, Donaldsonville, Louisiana, resolution supporting the reappointment of Ms. Tanya Mitchell and Mr. Falcon Meir to the Board of Commissioners. Whereas the West Ascension Parish Hospital Service District, parentheses, the district, is governed by a 5-member Board of Commissioners, parentheses, the board, established under Louisiana law, tasked with oversight and strategic direction for the district's hospital and healthcare services, and whose members serve staggered 6-year terms to ensure continuity and long-term planning. And whereas the board plays a vital role in shaping the vision, governance, and sustainability of the district's rural critical access hospital, which serves a historically underserved, low-income, and minority population on the west bank of Ascension Parish. And whereas effective board governance is essential to protecting local healthcare services, enhancing health outcomes, upholding the standards of the Joint Commission, maintaining compliance with Centers for Medicare and Medicaid Services, CMS, and ensuring access to essential services for all residents in the district. Whereas the terms of Ms. Tanya Mitchell and Mr. Falcon Meir are set to expire on May 2nd, 2025, and these positions are subject to reappointment by the Ascension Parish Council. And whereas Ms. Mitchell and Mr. Meir were originally appointed to the Board of Commissioners by the Ascension Parish Council on November 21st, 2023, and have demonstrated their commitment, professionalism, and compassion through their diligent service during the past 18 months. And whereas Ms. Mitchell is a resident of the district, an educator in Ascension Parish school system, a devoted mother of 4, an active community advocate whose passion for improving community health has been evident in her board service and engagement with stakeholders. And whereas Mr. Meir, a lifelong resident of the district and an attorney by education and training, has provided thoughtful leadership, legal insight, and steadfast dedication to promoting equitable, high-quality health care access for all residents of the district. And whereas both individuals have been compassionate, collaborative, and accessible leaders, consistently reflecting the values and needs of the people they serve and demonstrating their strong alignment with the mission and goals of the district. Go another page. Whereas the board believes that the continuity, knowledge, and trusted leadership of Ms. Mitchell and Mr. Meir are critical to the ongoing success of the hospital, especially during a time when rural health care faces unprecedented challenges and requires unified, mission-driven leadership. And whereas the board affirms that the reappointment of Ms. Mitchell and Mr. Meir reflects the will and trust of the residents of West Ascension Parish and ensures that the hospital service district continues to operate with compassionate leaders who understand the unique needs of rural healthcare delivery. Now therefore, be it resolved that the Board of Commissioners of the West Ascension Parish Hospital Service District does hereby recommend and strongly support the reappointment of Ms. Tanya Mitchell and Mr. Falcon Meir to serve full 6-year terms on the Board of Commissioners of West Ascension Hospital Service District. Be it further resolved that the board considers both Ms. Mitchell and Mr. Meir to be the most qualified and suitable candidates to continue their service based on their proven commitment to public service, deep understanding of the community, and a steadfast dedication to ensuring equitable access to critical healthcare services for all district residents. Be it further resolved that a certified copy of this resolution be submitted to the Ascension Parish Council and the Ascension Parish Council Personnel Committee as an official record of this board's support and endorsement of the reappointments. So there's the resolution.
And we fully support the resolution. All of us to this board on November year 2023. So roughly, we've been on this board now for close to a year and a half.
So am I hearing that right? You're making a motion to approve the resolution?
I wanted to make the point that all of us only been here like a year and 6 months.
Well,
Full term is 6 years. So
Right.
yes, so we're asking that Tanya and Falcon Mir be reappointed to do a full term on the board. So moved.
Okay, so we have a motion. We have a second. Any discussion? Any opposition? That motion passes. Thank you. All right. You didn't know you were that good, did you?
So the next item is our quality and performance improvement program. This program was brought before ER committee as well as our MEC committee. And I do want to introduce, because she's been on, Teams meeting for the last 2 meetings, but I wanted to just introduce y'all, to Ms. Crystal Mitchell. Ms. Mitchell, has been working with us for the last, 9 months now? Yeah. 5 months. On our very important role, which is our nursing department, to make sure our nursing department is where we need to be. Moving into the new CMS regulations, and also what Joint Commission is looking for. So she's been working hand in hand, not only with Ms. Anastasia and her team, but also for our entire clinical aspects of the team. So Ms. Crystal was able to bring before us our policies last month. We do have more policies this month that we already sent to y'all for review. So she's going to briefly go over your policies, and you can have some questions to ask her if you have any. So, Ms. Crystal.
All right, thank you guys for having me. It's been a pleasure working with you and your team. Essentially, what is my role with you guys? I identify your blind spots and your gaps, right? I'm the one that every day when a new reg rolls out, is it applicable to West Ascension? Is it not applicable? And is there an alternative or creative solution in the way that we operate? Looking at, do we really need things, right? Because we all know that just because a new reg comes out doesn't mean we need a new policy for it. So I'm your person that was that person in Chilton and Anastasia's role, where the least amount that can put us into a corner per se from a regulatory component is the best thing that we can do. We want to operate as much as we can by procedure, right, in a clinical world. So what we do is, the first thing that I identified in all of the departments, when it's not just nursing, it's respiratory, it's across the board, is really seeing what do we have and what do we not, right? And then is it outdated? So we did have a lot of great things for West Ascension, but we have a lot of outdated practices that, as Joint Commission was flying, right, we're just trying to hold on to the seat of our pants. With that being said, what we took the opportunity to do is really just honestly scrap what we were doing and really build it from evidence-based practice and make sure that we're doing things in line with CMS, our state licensure, because Louisiana is very different than any other state in the United States, and then also Joint Commission, but not creating too much where it's a barrier, right? We want to know what we're doing. So that's the biggest thing. Can we translate it into practice? So moving kind of quickly, what is quality? What does that mean for you as a board, and what does that mean for our citizens and our constituents of our area? Our quality department is a requirement from any of those federally funded programs that we get money back and receive, and that's what keeps the doors open, right? How are we doing? How are we measuring that? How are we tracking it? There are things called elements of performance. Those elements of performance, we didn't make them up, right? Those people in DC made them up, and our surveyors, they go by a checklist. We want to make sure that we're adhering to that checklist, and when they come in the door, we're prepared to show them. We want to be proud of what we're doing in about 6 months when they come. And so that's why I'm here, to really help you guys through that, to guide you and to be there, to be your advocates on this side. So we want to start and get the things that we know that we have to have right now to start moving forward as we're already riding the bike down the street. So the quality department. So that's how we track, how we monitor, how we share with the board, how we share with our staff, and then how we share with our citizens. Basically, all of these different policies, and there's going to be a lot more coming down the line, but they're specific elements, specific conditions, and they may say some of the same things, essentially, but it's those that align with those specific outcomes. So you see the death reports, you see the restraints, you see the transfers. Well, each one of those has certain things, and that's what the policies are going to reflect. So you get the outcomes, but there's policies that go behind why, the rationale behind what we do. So we're seeking approval for the quality department, how we do that, how we share the outcomes, and how we learn lessons from that in driving to zero harm and to becoming a highly reliable organization. The next thing is on infection control, and I know you're probably thinking, oh my gosh, you had 17 policies last month. Infection control is the epitome in the existence of one of the hardest things that a hospital can do because it touches every single person, right? It touches administration, it touches dietary, it touches the patient, it touches the way that we care for our patients, and it touches every visitor that walks through our facility. So we have to have a policy for each one of those things on how we act, how we interact, and how we track and monitor those things. Within that is how we monitor the federal government through CMS, which I work with the administration very closely on, through a portal called NHSN, which is a requirement of how we get funded back. And then additionally, we have this wonderful website with the state of Louisiana called IDRIS. And so it's very different than a lot of other states. So we have required portals in order to keep the lights on, the doors on what the things that we have to do in these policies back at home. And so this is the practice, how we inject, how we dispose of those. That also outlines, so when I do these things, we do what's called a crosswalk, right? So I don't have to make a separate policy for one for CMS, for Joint Commission, for OSHA, for NFPA, or NFPA for our fire code. What I do is do it, and we all reference all of those that may be applicable to. So it's one policy referencing everything that would be applicable to our practice setting. So I really make it as user-friendly and is applicable to who is carrying it out, and then that the average person, if it doesn't matter if it's our volunteer services, our pink ladies at the front door, and they're still required to adhere to these policies, or if it's a physician that has years of experience carrying it out, they should still be able to read the same policy and understand. So that's our goal.
So let me ask you a question. You talked about in the beginning, reviewing changes. I guess that's at the federal level. Is that correct on regulations, rules and regulations? Well, what about the state legislature? Do you?
So I do all local, state, and federal level.
Okay, good. They could be making a law right now that affects us.
They could, but yeah, we have our ears close to the ground. We also have lobbyists that we partner with very closely, and that we are definitely applicable. I stay really closely in touch with Shelter Home Opportunities, strategic vision, goals, what other critical access hospitals are doing, which is very imperative. I do have some things that I would love to share with you guys at another time. On opportunities for growth expansion, and then which kind of goes in line with our social services on federal funding that is coming down the line for FY26 through 28. And we want to be, we should be out there and being able to potentially even get grants. So we want to have those conversations because we need to be prepared for what's coming down the road and for what's Ascension and for the area, as long as with the strategic growth of the plants that are coming. So we want to be able to continually service that. Be able to enhance our reimbursement rates, strategically grow West Ascension, but then also meet the needs of our community, because that's why we're here.
Thank you.
So as you see right now, Joint Commission is coming soon. You don't see any red flags. There's nothing for us to be concerned about right
now. So having complete transparency. I shared learning lessons with the entire leadership team from West Ascension this week. Our team, we cover 28 states currently, from Alaska to Florida. And we have clients in every large, small, all kinds of different settings for hospitals. We're seeing trends with Joint Commission currently. We have a very close relationship with a lot of the surveyors. We do have some gaps. We have some critical gaps. However, on the positive side is we have reverse engineered our negative gaps, and so we've been working with Ascension, actually the whole team today, including compliance risk. And so what I like to do is take all of what the surveyors are going to do, get those first, which we've already begun, assess those gaps and fix those gaps, and then develop the policies that are going to align with that, as well as the quality standards. And then as we're going forward, it's kind of like we're riding the bike and building it and fixing it at the same time. So while we know what they're going to ask, and that's what we prepared for today, we've also begun standing up our incident command. So while we're standing up our incident command, we know the questions they're going to ask. We've already done our chart reviews. We have developed the quality product. We've developed the audit policies. We have a quality policy to go in that. We have a dashboard that is being created that will be shared next month with you guys. So we're doing all these things, and then we're also having the physicians involved for the medical review process. So we're answering all of their questions and identifying the highest gaps first, right? So we want to identify the highest, most critical areas and then work backwards. So, it's just the same thing as, if your house were on fire, you want to hit the fire, you don't want to hit the front door if it's not on fire, you want to hit the roof because the roof can expand. It's basically the same thing. We want to hit where it's going to have the most presence and then kind of work backwards. So that's our strategic plan right now.
Yeah, that's good, because with Joint Commission, we don't know when they're coming.
Correct. I can say, because we are involved in those, just last week I was in California for a triannual survey, and they waited to the very last week of their expiration. Previously last year, they were 3 months ahead. However, they've had a lot of turnover, and we have a lot of new surveyors. And when I say new, getting very minimal experience in the field. They may have experience in events that are their applicable field, but it's been interesting. But we are seeing trends, and I've shared all of those trends and the learning lessons and the regulatory components and what we're looking for and the rationale with the findings work with the entire team. And the reason I do that is because we're seeing those. Why don't we go ahead and get ahead of it? And we know if they're going to come, they're probably going to look for the same thing here, right? So then, like for instance, James and his team, his environment of care and life safety, he can go ahead and start knocking those out and getting ahead of it. And so that way, if we don't have a plan in place, we can get one.
You're saying with the turnovers, we should have a little bit more time.
Yes. Yes. I'm confident by the time we do have gaps, and we're not gonna, sugarcoat that, but we're working very hard and very diligent to cover the biggest area of needs first.
All right, thank you.
We can assure you, what I like about, what Mrs. Shelton's put together, Mrs. Christian's Anastasia, and the whole team, we're acting as if Joint Commission is coming tomorrow.
Yes.
So we appreciate them helping us to guide us along the way, but we're acting as if tomorrow is the day.
They can tell you, the staff can tell you that we are in that sense of readiness, and we are moving. Quincy is working with his team on pushing out, look, we're not waiting for Joint Commission, we have a survey every day. And this is what we're gonna find, this is what we gotta do, and staff has been very welcome to it. And that's what we need, that's what we're going to continue to do.
Yeah.
So, like the special said, we've identified some areas that we need to improve on. That's great, that's learning. You know what I'm saying? Nothing is perfect, but we want to keep moving in that perfect direction.
And I think, the biggest thing of the outcomes are, if you're regulatory ready at all times, right, there's no surprises. The one thing that I did share with Shelton earlier, and actually the team, was the last 2 surveys, the last 2 weeks in a row that I've been in, the surveyors had already read the 2 previous triannual surveys of these hospitals and already were coming straight for those things to make sure that they were not prepared. So they are already, and they were very open and sharing, like, we're coming looking for these, and this will be an automatic citation. So we want to make sure that we're prepared for those. And then the areas that we know we just can't fix right now, if it's something that we can't get to, we need to have a plan in place. And so we're making those modifications so that we're not blindsided. I'm very prepared. I don't like to be blindsided, and we are making those. And again, we've already stood up our incident command, so we're prepared, and we're already having our sheets, and we're prepared, and whose role is what and what the responsibilities are.
Thank you.
Okay, thank you.
Mr. Dawson, if I can get a motion to approve your infection control policies and your quality department policies. Again, this was brought before ER committee, they approved it. This also was brought before Environment of Care, was approved by ABC.
So, I'm sorry, say again what the motion should approve.
Motion to approve your quality and performance improvement program with the policies listed.
Well, what we're gonna need to do, and I'm gonna have to back up after this, but we're gonna have to ask if we have any comments before we can vote on it.
Okay, yes, sir.
All right, so do we have any public comment on a vote to approve this quality performance and improvement program? Any public comment? We don't have anybody signed up over there, is that correct?
No, sir, we do not.
Okay. Okay, so I'll open the floor for discussion or voting. Or a
Well, I
motion.
move that we approve the quality and performance improvement program.
There we go. Okay, I have a motion and a second. Any discussion, any opposition? Hearing none, that passes. Thank you. I've got to back up because, you know, I changed this and I didn't ask for comments as we did this appointment resolution. I promise you, I'm not going to read this whole thing again, but what we need to do is I need to ask, are there any comments on item 6C, resolution for commissioners' appointments? Are there any public comments for this item C? Is anybody signed up for that? Okay. Well, then we're in good shape. I was going to get us to vote again if we had any comment. Okay.
All right, so now I'll go over our board standing education and announcements that we have. Ms. Crystal and her team is working on our March 2025 assessment, so I will have that for us in April. But I also want to go over a little bit of where we're looking at for our Medicare and Medicaid updates that's been coming out. I sent that to the board last week, and Mr. Dalton asked me to give him a revised the issue, so I wanted to break that down because he knows I like to write and I like to cite stuff. But the new update says the proposed Medicare payment increase offers a potential revenue boost of right at 2.4%. Elimination of certain quality measures may require adjustments in compliance and reporting strategies to maintain payment levels. Reduction in our Medicaid funding may impact our hospitals in Louisiana. That's a serious one. So we are looking now as I get ready for budget. It's going to be where James and I are going to be sitting down. All of our current programs, everything that we're doing, I'm going to be looking at the effectiveness and being able to sustain it. Insurance compliance with both Medicare and Medicaid changes is critical and crucial for continued funding and our program success. And I'm glad that Ms. Buggage is here, and I will have something for Ms. Buggage later on. But working and having these Medicare and Medicaid updates is critical. And as things change, I want to make sure that we are presenting that and bringing that to the board. Right now, we're in a good position, but things are changing fast, really fast, in our state, on the side of Medicaid. So we're going to be actively looking at that. Any major changes that we have that's going to directly affect our district and directly affect this hospital, you will be the first ones to know about it.
And Sheldon, let me ask you, do we have anybody on staff right now that's watching that closely?
We are, yes, sir. Yes, sir. So that's with Ms. Crystal and her team. And then we do have someone else that's about to come that's going to start looking at that as well for us. Another eyes and ears.
I mean, it's like a week-to-week observation, right? Because a lot of stuff that's going on right now, yeah.
It's daily, because a lot of things are changing. And the biggest thing is the funding for critical access hospitals and making sure, because we already have the big changement in the way that our payment models are coming out. Because we look at what we have for our cost reports and what's coming. So some of that supplemental changes is going to be very detrimental to us. So we have to make sure that we have people in place that are represent us and speaking about what we need for critical access in rural hospitals. So we're going to continue to fight for every dime that we can bring to our district. And I'm going to let you know that. Yeah. Next thing I have is this thing right here. So I'm going to turn it over to Mr. Frank. So this is just a screenshot. I want everyone to see what the van will look like once we finish. So Mr. Price.
You know, what we should have done was did what you call a before and after.
Oh, yeah, I did it before.
Usually we do that, but we didn't do that this time, okay? Well, before we started getting the maintenance done and the other things, the new wheels on the van, we wanted to show everybody the improvements that we've done to it. The van is going to be practically new when it gets back, and we're going to put it back in use because we need it, because a lot of our residents don't have transportation. And so, what we say now, we maybe about 2 to 3 weeks off now. But that's the wrap that you're gonna see on it there with the West Ascension Parish Hospital and other information, from our facility. And it's got a complete maintenance done. It will be complete, it will be like brand new when it gets back over here. It's got 17 passenger capacity and also wheelchair lift. So, yeah.
When we're looking at this, so thank you for that. Next, we're gonna have something that's passionate to me and passionate to the board. I wanna let Dr. Lewis stand up because I wanna be able to bring this before the board. And this will be our first time, and me even telling the board and telling the community of what we're looking to do for the summer. Well, we have a lot of students, in our district that all they want is a little money in their pocket to go buy them their nice shoes for school to start back, or to take their girlfriends on a date, or even the girl taking their boyfriends on a date, whatever the case may be. But we want to be able to help out. We have so many students in our district that are having a hard time. So we want to be good stewards, and we want to be able to start a program, the Summer Youth Job Program, where we engage with our board. We're going to have 15 students. Each board member will have the opportunity to pick 3 students, okay? 3 students that reside in the district. We're looking at 6 weeks, from June 10th to July 19th, 6 weeks. 6-hour shifts, 3 days a week. Making, 13, 15 hours. I tell you, my first job at Jack Brown's in Franklin, Louisiana, I started out at $525 an hour. So for our children to make $13.50, that's going to be a total of $1,458 per student.
That's a 6-week period. Go ahead.
So HR Fridays, we're going to have workshops. And those workshops about time management, budgeting, and financial wellness career development. Dr. Lewis?
Thank you, Dr. Daniels. The only thing about it is we wanted to be able to not only, it's basically to show education, mentorship, because we want to be able to, as a hospital, also show kids future. Okay. Excuse me.
Yeah.
We want to be able to apply health. We want to be able to show experiences of health professionals here in our community. And, we have some great healthcare professionals here. So we want to be able to have them to the community to learn basically. So that is another way of giving back. It's another way of providing education and kind of applying it. Not only letting them see the health needs, but also to apply and learn about health careers as well.
And basically with this, I want to be able to bring our babies into the hospital. A lot of our students, only come to the hospital if they got to get some shots or they got to go to the ER. But we have a lot of kids in the area who want to learn, I may want to go into nursing. I may want to go into respiratory. I may want to go into maintenance to be able to show them what you can have right here. So being able to offer this program is going to be beneficial. I am asking the board on behalf of our hospital, looking at from program suppliers. So each student will have a shirt that they will wear each day to the hospital that they're working. And I have a very strict policy at the hospital. For my guys, the shirts must be tucked in. So you come into the hospital and you working, your shirt's gonna be tucked in, your pants must be pulled up the belt. So we're gonna provide them shirts, the meals, as well as the field trip, and we're gonna do one educational field trip. That's gonna be a total of $21,000. The total cost for the summer youth job program would be $24,000. So we are asking that we bring before the board for $24,000 for this program. Now, the good thing I want to tell you about this is just a start. That's just start. We've also been speaking with other leaders and other organizations in the state that have matching funding and grants that we can be able to start to utilize, especially for the west side of the West Bank. Okay? So we're thinking about even our children that have dropped out of school and now want to get back into school. We have that program. We are now beginning to work with, our friends at River Parish Community College. Maybe some of the students want to, go into medical assistant, or want to go into nursing, or want to go into HVAC and different things like that. Well, guess what? Now we have that funding that now we can be able to start utilizing. So yes, it started off as a summer job program, but we want to be able to expand it to a year-long program where they get those hands-on experiences. So I believe, and the staff believe, that this is a great investment into our future, because our children, we know, are our future. And we also know that health starts with our babies. So we got to practice what we preach. And what that means is now we got to start giving back into our children and being able to have a healthy type West Bank. So that's what I'm offering. That's why I'm asking the board to take that into consideration at this time.
Within this, would you be discussing other fields that's, okay? Because I really think it's important, because kids really don't know about those other fields, So that's my question. Okay.
So one of the big things, I'm glad Dr. Lewis is up here, is about how to tie a tie. I have so many young men that don't know how to tie a tie. I have a lot of young men who don't, and young women who don't know how to sit there for a job interview. So Dr. Lewis and Mr. Reshore and Mr. James are going to be able to sit down with our students as they come. And Ms. Anastasia, I haven't told her, but she's probably going to be able to give some education on what you do when you get ready to apply for those jobs. Not only that, but for the ones that are going to be becoming seniors, working with Dr. Lewis and working with Dr. Levy to make sure that that they know how to apply for student loans, how to apply for these colleges. So this is the step one that we are planning to do for our students. But this will be a great opportunity for everyone and for this community.
And I am part of the youth job program from 14 years old to 17. So it's very encouraging to have your own change.
How are you going to advertise this?
How are you going to advertise?
So we are going to start advertising, and this is going to be given to the board of directors. We put on our Facebook page, also put on our website, so where students will be able to apply, and then they'll be able to apply, and then the board of directors will be able to take those applicants and be able to determine who they want to start off with this cohort, and they'll be able to move forward that way.
Is there any criteria for somebody that applies? Like, for example, do they have to live in Ascension Parish? Do they have to live in the district?
So we are really going to focus this cohort on this side. And
On this side.
On this side. And
But you can't go down to Assumption.
no. So look, we have a great parish. We have a great parish. However, I want to start off with our community right here.
And I think we have a lot. We have a lot.
I think if you could advertise this in the schools, they
Most
would
definitely.
fill up in a minute.
Definitely.
And the good thing about it is, Dr. Lewis and Quincy, so the students are not just going to be assigned to Ms. Anastasia and her nursing department. They're going to have a rotation. We're going to rotate throughout the organization. Because guess what? I got plenty of grass that can be out there that they can help out with and picking up trash. Because guess what? I started out by picking up trash. I'm okay with that. So, and I'm also okay with learning how to properly disinfect and clean those bathrooms so we don't spread those infections. So, we're going to have a rotation of our hospital and being able to work in different multiple areas to learn what we do here at West Ascension Parish. That's how we're going to keep building the organization.
Let me tell you, I fully support this. All right. 2 years ago, our organization, the Sunrise Community Group, received a $25,000 grant from the Department of Revenues, Louisiana Department of Revenues. And we used that money to put our young people to work during the summer. The state limits the age at 14 to 18. But I'm gonna tell you something. So we chose one day, Saturday. We did it for 6 weeks, and we were able to put 50 kids to work on those Saturdays, each of those weeks. We had another 40 kids trying to get into our little program. It's here in Donaldsonville, Louisiana, here in West Ascension. Most of our parents, or most of our families, are single parent. I'm talking about 55% or more. And a lot of these households are poverty stricken, either at or below the poverty level. So a lot of what the kids want in the summer, mom and dad really can't afford it, or mom can't afford it because she's raising them herself. One of the things we noticed too, that our juvenile crime rate spikes in the summer. All right. As a matter of fact, it's already high. It's just too high for a small community like we got. So when this idea first came up, matter of fact, we had a meeting here last week with the Ascension Go Jobs. And Ascension Go Jobs has a lot of programs, a lot of on-the-job programs, a lot of training programs for young people. And actually, we didn't really know about it. Now we know. So going forward, we're going to be able to take advantage of that because right now, they got $3 million sitting in the bank. But no one has really been engaged in it. But we will, because these type of programs is what our community need. Because our young people, it will teach them work ethics. It will show them that you can go to work on a paycheck, and now you can buy those shoes that you want, that mom can't afford. Or now you can do these other things, these games that they love. It's just so much you can do. And I'm gonna tell you, when we did our program, those kids felt so good about that they were making money. They're making like I think $3 a day on Saturdays, and they were so happy about that. We set it up where we would write them a check, and then the next table you can cash your check, and they loved it. So I fully support this, and I'll hear what the rest of the board got to say, but I'm ready to make a motion that we implement this, because this is what we want to do at the hospital. We want to provide quality health care, and you can see the plans we got. We're going to do just that, but we want to engage our community. And the way to engage our community is with our children. So fully
You
support
say you're
this.
making a motion?
If there's no other comments, I'm making a motion.
I fully support this. I think it is a great idea for our community, for our children. I'm an educator. This is gonna be 21 years. And right now I'm an assistant principal at a high school, but I have a freshman academy. And the stories that I hear, I don't want to echo everything you said, but everything you said is correct. Providing those students with opportunities, the exposure, and just for them to see that someone believes in them and can give them an opportunity or a chance. Just having a chance. Sometimes it's the hopelessness that you see in these kids' eyes. If you can take that out with anything you do, and that's what I work every day to do. I'm there as an educator, but I pour into children, and so they can feel that they can, and they can know that they are somebody, and they can do anything that anybody else can do. And so to provide something like this on the west side, this is a great start. I can only envision it being bigger and better to come.
Yes.
But I fully support this. And like you said, you have to look at what it impact, the other things that it impact, like crime. If I have money, I don't have to
That's right.
rob. But this is reality. These are the things that's happening. So, the crime rate, it could possibly impact the crime rate. So I'm all for it because these are the things that align to what I'm doing in education.
And just to piggyback off of you, Dr. Levy, I want these kids to see that they're the future and maybe come back to the community.
Okay, any more questions? So we have a motion and a second. Before we can vote, we need to see, is there any public comment on this item? Anybody signed up for public comment? Anybody wanting to? No. Okay, so we have a motion and a second. All in favor, say aye.
Aye.
Any opposed? None. The motion passes, and I support it 100% myself. But I would say, one thing I kind of question is letting the board appoint the people. I think the administration should be able to figure out who.
Thank you, board. Great opportunity.
Daniel has 4 to put in.
Good, good. Well, thank y'all so much for doing that. I'll be able to share that with our staff.
Very
But
good.
if you would like us to be a part of that process with you all, I'm open to it.
Don't worry, you know she's busy. So, moving on a little further, I keep bringing this to us because I want to make sure that we, as a board and we as a community, we know what our future looks like, what we're trying to work on. So making sure that we are focusing each and every board meeting, looking at what a rural health clinic at Ascension Parish can look like. 3 exam rooms, staffed by a full-time nurse practitioner, part-time family medicine physician, servicing primary care, urgent care, mental health, occupational preventative, patient volumes, 12 to 15 visits a day in year 1, up to 20 patients a day on year 3. And then being able to look at rapid build, launch with lower capital costs. Diverse non-emergent patients from my ER, improving our throughput.
Interrupt you. Is this on the agenda?
Yes, sir. Yes, sir. We're going to get board education.
Where is it? Oh, it's under board standing education
Yes,
and
sir.
announcements?
Yes, sir.
I don't think that works. Huh?
Here,
This is the agenda right here.
correct. But I was saying, that's,
It's gotta be on the agenda.
It is on agenda.
Right here.
it's on your agenda.
It's on the back.
Yeah. Yeah, that's it.
Primary care clinic consideration.
Primary care clinic consideration, okay.
Okay.
That's it on the agenda.
All right, so I see it now.
All right.
Okay, sorry.
So your community impact expands access for underserved rural populations, promotes health equity through primary and mental health access, create local jobs, and also enhancing continuity of care. That's what we were focused on. So you see, I've got a pro forma for us for our first year. So 138,000 on our strategic investment. Year 3, we had our break even in growth at 86,000. And year 5, looking at 195 for our positive margin and reinvestment. So I just wanted to bring that to consideration. We will have more further education.
Are you asking for any action tonight?
No, sir. No action tonight. I wanted to put this so that you all can know what we are.
And tell me what does a modular mean? Is that a trailer or what is that?
So just to kind of support Shelton's talking points. So we have a couple of options. The one thing on the strategic growth for West Ascension that we are critically missing is the primary health care clinic. Okay, so when we think of primary health care, don't think of across the street. It's not that, right? It is servicing our community, but there's so much more. Because West Ascension is a critical access hospital, it's very different. Then we asked, will we go through the conversion process from converting it from a primary healthcare clinic to a rural healthcare clinic? Why do we want to do that? Across the street cannot get the same reimbursement that a rural healthcare clinic can. So you have enhanced reimbursement rates through Medicare and Medicaid, right? Additionally, I would like to point out that across the state, we service 13 other critical access hospitals and partners. This is we're a Louisiana-based firm. We have gotten close to the break-even point or the complete reimbursement after year 1. So Shelton is being extremely conservative with you guys in sharing that. One of the other things to help with the initiatives is mental health services is strategic for our growth. One, we've already shown that the need is there. Additionally, adolescent and pediatrics in the state of Louisiana has a critical need. We already know that there's not enough hospitalized beds. Beyond that, we don't want our kiddos in the hospitals if they don't have to be, right? We want to service them here. With working with our primary healthcare clinic, our rural healthcare clinic, we're able to utilize telehealth services. Why is that important? We've already said that we know that 1, we're underserved, 2, our socioeconomic status is, decreased, we are at poverty levels. Our kids may not have a ride here. They may not have someone to get them here, but they may have access to a telephone. We can do telephone services, we can do telehealth services and expand that. Why is that important? CMS and the Department of Health and Human Services has already stated in just this last week that there's going to be funding coming down the road for FY26 through FY28 for critical access in rural health hospitals across the nation. They're going to look at those areas of need or those desert areas first, right? Louisiana's a desert area. Why is that important? Well, if we don't have a rural health clinic, we can't have a telehealth services. If we can't have telehealth services, we don't get that funding. So we're losing out on opportunities for expansion, for growth and initiatives that we're just leaving funding on the table, but we're also, we know that our community needs it here and we have an opportunity to help.
But do you expect to see less in the emergency room if you open this up?
No, it's actually quite opposite. So what we see is kind of what your numbers are starting to indicate. While you may see the census may change, what you're seeing is the acuity changes of that patient. And what that does is the higher the acuity, so the sicker the patient, the higher the reimbursement because the coding is higher. Okay, so you may, let's just say, I'm just going to use equal numbers, it's not literal numbers. You may see 100 less patients, but you may see $3 million increased revenue because they're sick. Right? Because we're doing our job in our clinics to keep the patients being treated. We're evaluating, we're doing our annuals, and then we're also making sure our immunizations are up to date, which we also get funding for. And then our community wellness is improving, right? That also goes hand in hand with our community needs assessment that we're required to share that you guys go by. Additionally, we hadn't even gotten into the telehealth expansion with our schools. So we have an opportunity to partner with our schools and school-based health and really dig down deep there. We've partnered with 28 parishes across the state and really helping them. And then we haven't even partnered with our Bureau of Prisons and our local prisons there, because then we can also do consults and keeping, so we have to do screenings on some type.
So was I originally asking about modular? What does that mean?
So modular, the state will grant some exceptions from time to time if we're not going to build in a fixated permanent structure, right? We know that the expansion wants to happen with the new hospital. We know that we want to hopefully build a patient metaplex. That's where that could go in the future. But we want to be able to stand up operations as fast as we can.
I mean, that would be like a prefabricated building or something like that.
It would be. Now, the state is very particular on what that looks like and how the recommendations are. So there's a lot of process and approvals, but there are whole companies that we will partner with.
Well, obviously, it has to fit into what, once we get the big plan to what we're going to keep and what we're going to build new.
Yes.
That has to fit into that. I mean, I'm all for this. We talked about this for a good while, but we also are down this road of trying to see where we're going to do an expansion, and this was one of the things that we talked about in what.
I can say too, just you can always repurpose the buildings. Right, so if you make the investment in that, we have another critical access hospital that they initially stood up their rural health, primary health clinic. They did the conversion to the RHC.
What are you talking about? Just exam rooms here?
So it's exam rooms, treatment rooms. You have to have a medication room. There are specific requirements from LDH, but it can be reused. So I'm going to give you one quick example. We know that OB care it's very hard to come by in the state of Louisiana. Hospitals are shutting down OB services across the state. What one hospital did to critical access is did the GYN component and you utilize that building that they previously did their primary health care clinic for GYN services on an outpatient only. So that they've expanded services for follow-ups, and now we're meeting a plethora of ages that it was a whole service line that they never even initially dreamed of.
You know something, I like it. I mean, I think that we need to see a plan with a budget.
Yes.
All right. I mean, we're talking about enhancing the clinical services, from our hospital, from our facility. Yes. Let's put a plan together.
Yeah, and I didn't see what it cost to build the building when I looked at the details here. It just started off with revenue. It didn't start off with Then also, at one time, we had talked about maybe some of those inpatient rooms could serve as exam rooms.
So we can't do that. And so it's very clear on critical access on, well, any hospital, right, on operations of the umbrella under the existing footprint. And so it's very clear for what can be an RHC, what can be a primary healthcare clinic, and what are outpatient services. So while outpatient services like the wound clinic is operating in unused rooms that we can have it's called dual service, and it meets the requirements, that's fine, but you can't operate full clinics in licensed beds. And we never want to lose licensed beds because it's what we've already been granted. You never want to get things taken away, you always want to enhance.
Yeah, I mean, let's see that plan. Let's put a plan together. Yeah.
All about the plan.
Now, so briefly, then I'm very brief, Dr. Lewis. So we got two things coming up that's gonna be fun that I wanna get the board involved, also wanna get the community involved. First is hospital week, Ms. Anastasia, you and your, no, nurses week. Tell about your nursing week, Ms. Anastasia.
So we have several different activities for nurses. Plan is, from May 6th to May 12th is Nurses Week. So we have a sock nurse, and we have, things to soothe the nurses' feet and socks, for the nurses, but they also get to wear fun socks in the hospital votes on who has the funniest socks. We have a superhero day. We get to dress like a superhero. Gentivo, one of our, hospice companies, donating, snowballs. We have another hospice company, bringing them some cookies one day, and then they have a big event, on May 9th right here, where they, do some painting. And also, we are going to give out our first deity award. So, on that night, it'll be the first time here that we actually get the deity award. Get it that night.
Is that what she's on this?
That's May 9th, you said?
May 9th, 4 to 8.
Dr. Lewis is gonna tell us about, thank you, Ms. Anastasia, gonna tell us about our hospital week.
Okay, so basically, Hospital Week is, the theme this year is 2025, America's Hospital, a symphony of compassionate care. On Monday, we're gonna have Rise and Shine leading the way. They're gonna have breakfast, chicken tenders and waffles. The activity will be a leadership appreciation board, and the board itself, you can highlight, our different employees. That'll be on Monday. On Tuesday, we'll have taco about teamwork, just tacos. The activity will be Team Spirit Challenge. Departments complete in a fun trivia or relay race. Wednesday, just winging it, soaring together. Of course, they'll have wings and fries. Activity will be the take flight. Employee write down their professional goals and display them on a Wing Up Success board. Thursday, brawling over with appreciation. Of course, we'll have a cool crawfish brawl. The activity will be employee recognition ceremony where they will celebrate outstanding staff with fun awards. And last but not least, on that Friday, we'll have a carnival of care where we have a nice carnival. The activity will be like a mini carnival with fun games, ring toss, balloon darts, and different prizes. So make sure as the board, you join in on those activities.
And what are the dates again?
May the 12th through the 16th.
12 through the 16th.
We also have our first time doing our special, the legacy ceremony.
The champion ceremony that we're gonna have, we're going to look at employees, past employees who gave, hospital 25 plus years of service, and recognize them. And we're also going to start recognizing our employees who've been here with 5 years experience, then 10 years experience. Start giving them things like it's a certificate or something to let them know that we appreciate them staying the course, the hospital.
So we had talked a little bit earlier, and I would like to see us spotlight some employees and do a video of that and introduce the public to our employees. Maybe these service awards are a good, start to that, but.
We actually got, one today from the wound care clinic where they got, excellent in customer service, here, 100%.
Yeah.
So.
So maybe we could video that presentation or, something like that.
Yeah, that'd be good, really good. I mean,
It's gonna be two fun-filled weeks, that we're gonna have in the hospital. I encourage the board to come, Mr. Dalton. And you come to the Crawford Bowl now, be careful now. But anyway, we're gonna have a great time, so that's what's coming up. Last thing that I wanna bring.
what time is gonna start each day?
We'll be able to, we'll send that to y'all. Awesome to have that. The biggest thing that I'm looking forward to is that, chicken and waffles. We all love a little chicken and waffles. This will be good. Last thing I wanted to bring before you, each and every year, for years back, the Ascension Parish Hospital has been able to donate to our teachers, and our staff, teachers in the community. So we're getting ready for Teacher Appreciation and Staff Appreciation Week, at the local schools. And we're gonna do something as an organization, but, Mr. Price wanted to make sure that we, recognize, is it Lori Price?
Lori Miller.
Lori Miller. So, Mr. Price?
Well, like Shelton just said, we want to support our teachers and the staff of our schools. I think too many times they're overlooked. They're definitely underpaid. I never understand why they get paid so little, but they work so hard. And one of the things I found, because we do a lot of interacting with some of the schools and some of the teachers and administrators with our organization, the Sunrise Community Group. So now say, okay, here at the hospital, we want to be community engaged. So we want to engage our schools, our public schools. We got the Ascension Catholic here in town. We want to engage our schools and begin to interact with them and do things, but show appreciation to the teachers and the staff, the janitors, the people that work in the kitchen. So what they do, they have their appreciation. So they've been doing it every year now, and we just haven't really paid attention to it, or it wasn't brought to our attention. But Lori Miller is going to have their appreciation week. That's going to be I think the 12th through the 16th of next month. And they can only receive small donations. All right, matter of fact, individual donations can only be at $25 per person. Like for instance, if the board wanted to donate, we can do $25 each. But instead, you can donate like $500 to buy lunch or help contribute to buying lunch. So my suggestion is going to be to the board that we donate $500 to Lori Middle School for the Teachers and Staff Appreciation Week for May 12th through 16th.
$500.
Yes, sir.
The Rotary does, they come and they do ice cream for all the teachers. And every year, and it's coming up in the next few weeks. But I don't have a problem with.
Is it not possible to do something for all the schools? Because every school has teacher appreciation. So,
Okay.
because I believe we can't just isolate and just do Lori's.
So I did ask, because I'm a West Side person, for all the schools, so he's gonna do breakfast
Okay.
for all the schools, and the Donaldsonville High has asked for something different, so we've catered to that. So Donaldsonville Primary, I spoke with, Ms. Leon yesterday, breakfast, she's gonna have breakfast, and Lori Alvaro is gonna have breakfast.
Well,
Donaldsonville High is asking for Subway, I think they said, so that's. I have not gotten from Ascension Catholic. Do you want me to get in touch if there's?
Yeah.
There's a connect person to talk.
I'll take care of it, Ascension
You'll
Catholic.
take care of, okay.
So if the administration can take care of it, then we don't have to we don't need a motion from the board. All right?
We do,
Okay, that'd be good.
we need a motion?
So do we know how much it is? How much it's gonna cost? Because we're not talking about the 500 anymore. I'm thinking we're talking about every school.
You're talking about the breakfast, I don't know.
Everything last year reported.
How many schools are we talking about? I couldn't hear.
5 schools last year, $1,200.
And,
five schools, and we spent $1,200.
That's five.
and we didn't have to approve that. It's coming out of the budget.
It's out of the general budget. This is part of the community, we have a bucket in our budget for community events. So this is like what we're doing with the summer job program, but it's part of that. And like I said, as I get ready to build out the new budget, I'm gonna make sure that we take what we did this time for the teachers and we'll be able to put a little bit more, if we can do something more next year. And then I get that approved through the board.
Yes. And I just want to say thank you. Every student at Donaldsonville Primary got an Easter bag, and they were real excited.
Every student, look at that.
Every student, every student.
Wow.
And also, this thing they also brought to the Head Start. I believe it was Ascension Parish Head Start. We'll find out. And then, of course, Austin the Easter Bunny, he was over there at the WAG Center getting out bags. That's good, but that's all I have.
I'm gonna do a summer visit to the early childhood center.
Yeah, so we all
Give you that.
where the leaders, our leaders.
Going in and coming out.
So, board members, thank you for your time. I want to thank the community. I want to thank our employees for coming to our board meeting. This yields all of the time that I have on new business, and I yield my time back to the board.
The next item that we have on the agenda is item 7, executive session. And this is what we added to the agenda at the beginning of the meeting. The title of this is Henry Chauvin Architects versus West Ascension Parish Hospital Service District, 23rd JDC, case number 139649-D, Division D, and in parentheses, authorization to enter settlement negotiations. So we need to looking for a motion to go into executive session. That takes a supermajority, 2/3.
I move that we go into executive session.
Second.
Got a motion and a second. Any discussion? Any opposition? Let me back up here. Again, do we have any public comment? All that we're voting on right now is to go into executive session. Is there any public comment on that? Right, hearing none. Then we have a motion and a second. All in favor, aye.
Aye.
Any opposed? That motion passes, and we'll go into executive session, and then there's just to tell everybody, there's a plan to come out of that executive session and have a vote. So you're welcome to stay or you're welcome to go, but there will be one more vote after the executive session. Don't hold me to it, but I'm saying probably we won't be any more than 15 or 20 minutes.
Oh, but I think everybody else up there, you come.
Excuse me, everybody. We do live stream our meetings, and it's going to continue going until the executive session is over. So you all being live streamed right now. Just want to inform you.
I came up, how are you? I will get back on the task All right. You're welcome.
Thank you, Dr. Lewis. You gone?
Yeah. I got patience.
I'll be calling our program, yeah?
So, okay, remember this, I'm gonna have to call for, to get these motions, I'm gonna have to.
I didn't see it on this. I was skipping around. Yeah, I went there.
All right, so we're gonna go back into regular session, entertain a motion. Back.
Move that we end executive session.
A second.
Have a motion and a second to be in the regular session. Any discussion, any opposition? Hearing none, the motion passes. So this is our session was to discuss legal counsel being able to negotiate settlement arrangement.
Yes.
So I'll open the floor for discussion or motions.
I'd like to move to authorize our legal counsel to enter into settlement negotiation pursuant authorization from our executive session.
Okay, we have a motion and a second to authorize our counsel to enter into negotiations under this contract. Is there any further discussion? So now I have to ask for public comment. Is there any public comment on this agenda item at this time? Okay, hearing none, then all in favor of the proposed motion, aye.
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 Any opposed? None. Motion passes. Entertain a motion to adjourn.
I move to adjourn.